So I need some help. Who is this woman up here? Serena Williams, yes, one of the greatest tennis players of all time. We all know this. But something you might not know is that a few years ago, she came public with her story of developing a life-threatening pulmonary embolism after giving birth to her daughter. You see, Serena has a history of pulmonary embolism. She had come into the hospital for a C-section, which meant that she wasn't taking her blood-thinning medication. She recognized the symptoms, communicated that to her medical staff, and they didn't believe her. They thought it was pain, and it took a lot of convincing to get them to finally do the proper testing and proper treatment. So Serena has this history of PE, which is a type of venous thromboembolism, or VTE. These are blood clots that form in the legs. They can travel to the lungs, cause shortness of breath, chest pain, and even death. They're nothing to mess around with. And study after study have shown that Black patients are at increased risk for these VTEs. We might understand a little bit of why, but we definitely don't know what to do about it. We don't know how to reduce their risk. Something else you need to know is that just being in the hospital puts you at higher risk of developing these VTEs. Think about it. You're laying in bed all day, you're not moving around, the blood is just pooling in your legs, and that makes it more likely to clot. Hospitals know this, and in fact, blood clots forming in patients in their hospitals are an indicator of quality. So we ask the question, does the hospital you choose impact your risk of developing these blood clots? Does it impact your risk of developing these VTEs? So what we did is we looked in a database called the National Inpatient Sample. We looked at over 1 million hospitalizations for patients who were coming in for surgery that put them at higher risk for developing these VTEs. And what we found was interesting. Only for the Black patients did the hospital they choose mattered, meaning that Black patients who chose a hospital with increased resources actually had a modestly protective effect. Their risk of blood clots went down by a little bit. So what does this all mean? Well, I'm telling you here that the hospital you choose might protect you, but yet here we have Serena Williams. She's a celebrity, she's a millionaire. She was probably at one of the greatest hospitals in the country receiving her care, and yet she still developed a blood clot that went to her lungs and almost killed her. So while our research shows maybe a step forward, it's only one step, and there's still a lot more work that we need to do to make sure that we can protect these patients and decrease their risk. So the screening that we're doing is not overcoming the increased risk from their race and ethnicity. Thank you.